Hello everyone, in this video we are going to see about side determination, parts and features of scapular bone. The scapula is a thin, large, flattened and triangular bone placed on the posterolateral aspect of the thoracic cage, against 2nd to 7th rib. Anatomical position and side determination. Scapular bone should be positioned in such a way that the glenoid cavity faces laterally, forwards and slightly upwards, at an angle of 45 degrees from the coronal plane. The coracoid process is directed forwards. The costal or anterior surface of the scapula is occupied by the concave subscapular fossa to fit on the convex chest wall. The dorsal surface of the scapula is convex and is divided by the spine of the scapula into the supraspinous fossa superiorly and infraspinous fossa inferiorly. Superior angle above and inferior angle below. Parts and features of the scapula. The scapula is highly mobile and consists of a body, 3 processes and 3 angles. Body of the scapula is triangular, flattened and thin. It has 2 surfaces, costal and dorsal surfaces, and 3 borders, superior, lateral and medial borders. Surfaces. The costal or anterior surface of the scapula faces the rib cage. It contains a large concave depression over most of its surface, known as the subscapular fossa. The subscapular fossa is concave and directed medially and forwards. 3 longitudinal ridges present, which provides attachment to the subscapularis muscle. Dorsal surface. The dorsal or posterior surface consists of the spine of the scapula, which divides the dorsal surface into a smaller, supraspinatus fossa, superiorly, and a larger, infraspinatus fossa, inferiorly. 2 fossae are connected by the sphenoglenoid notch, situated lateral to the root of the spine. Borders. Scapula has 3 borders, superior border, medial border and lateral border. Superior border. Superior border is thin and shorter. It extends from superior angle of the scapula to the base of the coracoid process. Suprascapular notch is present near the base of the coracoid process. Lateral border. Lateral border is thick and extends from inferior angle to the glenoid cavity. Infraglenoid tubercle is present at its upper end of the lateral border, just below the glenoid cavity. Medial border. Thin and extends from the superior angle to the inferior angle, also known as vertebral border. Angles. Scapula has 3 angles: superior angle, inferior angle and lateral angle. Superior angle. Superior angle is a sharp, rounded area on the scapula, where the medial and superior borders meet. Superior angle lies at the level of 2nd rib. Inferior angle. Inferior angle is a blunt, thick, and rough area, where the scapula's medial and lateral borders meet. Inferior angle of the scapula lies at the level of 7th rib or 7th intercostal space. Lateral angle. Lateral angle is also known as glenoid angle. Lateral angle is a thick part of the scapula where the superior and lateral borders meet. Lateral angle bears glenoid cavity, a shallow articular surface that articulates with the head of the humerus. A slight elevation above the glenoid cavity is called as supraglenoid tubercle. Processes. Scapula consists of 3 processes: spine of the scapula, acromion process, and coracoid process. Spine of the scapula. The spine of the scapula is a prominent ridge of the scapular bone, located at the posterior surface of the scapula. It divides the dorsal surface of the scapula into supraspinatus and infraspinatus fossae. Acromion process. Acromion process is the projection that projects forwards almost at right angle from the lateral end of the spine of the scapula and overhangs above glenoid cavity. Coracoid process. Coracoid process arises from the upper part of the head of the scapula and bends sharply so as to project forwards and slightly laterally.